Well, hello everyone, and welcome back to our daily health alert. My name is Lisa Majeski, and I'm the president and owner of Gold Star Medical Business Services. And I am here today to talk to you about another very important topic that hopefully is going to help our patients and even our practices get through and survive the COVID crisis, the national emergency that we're in right now. And as all of you know, if you have been on these calls over the last few days, you know that we have been bringing you some very, very important content and very relevant and current content to help you adjust to this new paradigm of medicine. We're in a situation right now where our patients cannot always come to us, to our offices to visit us. Some of us are in areas of the country where we're on a lockdown or a what they call a shutter in place or stay in place. And we're not, and for unfortunately for some of us, even a medically integrated practice or a chiropractic practice is considered quote unquote non-essential medicine. Of course, we would heartily disagree with that, but we have to go by what the government tells us. And so, with those things in mind, sometimes we're in a position where we cannot get to our patients physically, whether they come to us or we even can't go to them for a home visit. And so we have to look at ways to virtually deliver healthcare to them. Now, the last two presentations I gave during our daily meetings and our daily health alerts were on telemedicine. And there is another component of telemedicine that I want to talk to you about today, which is bracing and DME, because bracing and DME is something that we can deliver to our patients virtually. We can bill uh, through our insurance companies and bill some of these telemedicine codes through the insurance. And so this is a very, very exciting concept that has been around for a while, but we've not really needed to use it because we've had the privilege and the opportunity to have our patients come to our offices to deliver this bracing and deliver the DME supplies that they may very well need for their recovery and for their healing. So without further ado, let's go ahead and get started with this. And we're talking about keeping our patients stable through DME and bracing. So let's just answer a few basic questions. One is, how can DME bracing help our patients? Well, we know for a fact that in many cases patients can't come in for their treatments due to either self-quarantine during the COVID crisis or mandatory quarantine, which means that patients who may be under active care can't come in for their therapy. And if they're under a physical therapy plan of care, or if they're receiving functional medicine or functional care, they're unable to continue that in the office. Also, we know that our patients are more sedentary, and patients who are sedentary are going to suffer maybe spinal deconditioning, possibly if they have an extremity that has a chronic problem. That chronic problem is going to be exacerbated through inactivity and lack of exercise. And for those patients who have acute low back pain or chronic low back pain that becomes acute, they may not even be allowed to go to the emergency room for an emergency visit. But if they can't go to an ER, how are we going to help them get through that cycle of pain that they may be experiencing? So the good news is that durable medical equipment and braces can help patients with their recovery. It can help them stabilize their spines and extremities that are suffering as a result of misuse or inactivity, and also improve the quality of life for patients during this difficult time. It's interesting. I've been talking to a number of my clients, and for those of you who don't know what we do, Gold Star Medical, we are a full service medical billing company. We also provide training for staff on billing, compliance issues, and things like that. And I've had clients calling me and they'll say, well, I just got a call from a patient, and since they're at home, they decided to dig up a garden. It's the springtime, and they don't have anything to do, so they decided to get a shovel and a hoe and dig up their dirt and plant a garden. And now their backs are killing them, and I can't get to them. What can I do? And so we talk about virtual exercises and telemedicine for delivering exercise instructions and stretching instructions to these patients who are suffering from back pain. And we have two full presentations on that in the archives of the Daily Digest. And so if you go to daily.amidoctors.com, you can listen to those presentations on delivering telemedicine to your patients. But another thing that you could do is possibly help deliver a brace to them to stabilize their spines or stabilize their extremities, such as knees, possibly deliver TENS units to them and things like that. And so DME and bracing is going to be extremely beneficial to our patients during this time of home, self-imposed home quarantine. So what are some of the commonly prescribed supplies for physical medicine and chiropractic patients? So these fees that I'm showing you on your screen right now are Medicare allowables, because those are ones that I can easily get to. I can look those up very easily. And since I live in Texas, I just went ahead and looked at the Texas Medicare allowables as of January 2020 for these three. And we're just, of course, there are literally hundreds of DME supplies out there that you could choose from, but I really wanted to look at the top three that a medically integrated office or a chiropractic office might prescribe for their patients. One is a TENS unit. The other one is a lumbar sacral orthosis and a knee orthosis. And these orthoses that we're looking at are prefabricated off the shelf. So they don't have to be custom made. They don't have to be custom fit. It's basically going to come in several sizes. And so you would easily be able to prescribe these for your patients. Now, when we look at these, you'll notice that I use the word HCPC code. HCPC stands for Healthcare Common Procedure Coding System. This is a second code book that is used to describe DME and supplies. And kind of coding 101, we have the CPT code book, which describes medical procedures, and then the HCPC code book, which generally describes supplies. And I'm not going to get into the differences between the two code books. I can do other webinars on that. If this is something you're interested in, you can contact me and I'll be happy to give you a CPT 101 class. But essentially, we have two code books that we can bill out of. One is the CPT code book, and the other is the HCPC code book. And we'll note that the HCPC codes usually start with a letter and then are followed by 4 digits. And that's usually how we can differentiate a CPT code from a HCPC code, in that a CPT code is 5 numerical digits. So the HCPC code for TENS unit is E0730. The Medicare allowable, if you're in a non-rural area, is $54.95, $242.01 if you practice in a rural area. For the lumbar sacral orthosis, the reimbursement, Medicare reimbursement for L0650 is $1,212.68. And for the L1851, which is a knee orthosis with adjustable flexion and extension joint, medial, lateral, and rotation control, prefab off the shelf, HCPC code L1851 is $895.62. Now, when you look at what you would pay for those supplies, it is significantly less than what the reimbursement is. And so you would purchase the supply, you would have that supply delivered to your patients, you would bill your payer, and then you would receive reimbursement based on the payer's reimbursements. Now, what I do know of the reimbursements for commercial payers, I gave you the Medicare rates again because this is what I could get my hands on. Most commercial payers are going to have equivalent or even slightly higher reimbursements than this. Okay, so the reimbursements for DME is very, very good. The next thing to be aware of on the DME is whether DME is actually covered in medically integrated and chiropractic offices. I get this a lot. I have chiropractic offices that will say, well, I didn't know that DME was even covered, that I could even prescribe DME. And DME is covered actually more often than people think. It's covered by most commercial payers, and it is covered by Medicare in medically integrated and chiropractic offices if you have a DME credential or PTAN number, DME PTAN number. It's not covered under Medicare. It's not covered under your regular Medicare Part B PTAN. You have to actually have a DME PTAN to cover DME for your Medicare patients. Now, we're going to talk about that a little bit later on in the presentation on how to obtain that type of a DME credential through Medicare. So the next question that I get a lot with DME billing is, why do I have such a hard time getting paid? I've tried to bill DME in the past, and they usually just deny the claim, and then I have to have the patients pay for those services out of pocket. So many times what I find is that the reason why you're not getting paid for DME is because you're not billing it correctly. So the first important thing to do when you are looking at supplying DME or bracing to your patients is to verify coverage. The second thing is the supply that you are asking to bill for may require pre-authorization of service. So sometimes it's denied because pre-authorization or pre-cert was not obtained. Sometimes it's a wrong diagnosis code. You have the wrong diagnosis code attached to that supply, and so the insurance company tells you that it's not medically necessary. Sometimes, and this is more common than people realize, is that the place of service code for DME is different than the place of service code for medical offices. Even when you are supplying that DME to the patient in the office, you should be using a different place of service code in many cases. And sometimes what happens is if a DME is stopped, or a DME claim is stopped at the insurance company, they may request records and doctor's notes. And if those doctor's notes don't contain the correct documentation, it is going to be denied. Or if on post-payment audit, doctor's notes are requested, it is going to be denied. And there are some very specific pieces of documentation that need to be present in a provider's note, such as a letter of medical necessity, in order to have that claim paid on either a prepayment audit or on a post-payment audit. Make sure that money is not recouped after the claim has been paid. So let's talk about verifications, because really and truly, verifications of benefits are so important when you are prescribing DME or bracing for your patients. And the reason for that is every payer is going to have a different guideline and a different parameter for billing out DME or bracing to your patients. So the first thing you do is don't just ask if DME is covered. So I see this a lot on insurance verification forms. You have this little question on the form. It says, do you cover durable medical equipment? Yes or no? And the insurance company says, yes, we do. And the patient has this benefit for DME. And sometimes on the verification forms, they're so vague that it doesn't even ask the question, is there a different benefit? Is there a different deductible or a separate deductible and coinsurance for DME? And in many cases, there is. And so what you may find is that if you verify benefits for a patient for medical services, you call the insurance company and the insurance company says, yes, the patient has met their deductible. But if you don't ask if there is a different deductible for DME and you bill it and find out later that there is a deductible, you've just billed out a very high dollar item and have not informed the patient that these items are going to be their responsibility to pay for because they haven't met their DME deductible. And so always ask, number one, if a specific DME item is covered, not just DME in general, but let's say you're you're wanting to get a TENS unit to your patient, ask, are TENS units covered? All right, and give them that code, E0730. Is that covered under the plan? And then ask in verification, is there a different deductible or coinsurance for that, or does it fall under the medical plan? Does this supply E0730, does E0730 require pre-authorization? And if the answer is yes, how do I submit for pre-authorization? Okay, where do I need to send that pre-authorization request? And if your practice is not medically integrated, because under a medically integrated practice, you're generally going to order these supplies through your medical providers, your DO, your nurse practitioner, your physician assistant. But if you're not medically integrated, you need to ask, is this supply covered when ordered by a doctor of chiropractic? So meaning if a DC writes the script for that DME, would it be covered? And if it's not, then as a chiropractic office, you would have to work in tandem with another medical office or maybe another medically integrated practice in your community to have that provider see the patient, evaluate the patient, and then write that order for the DME. Okay. Are there diagnosis limitations? And again, this is very, very important. You need to know what that DME is indicated for. What is the diagnosis that supply is indicated for? So one of the things that I usually recommend is that if you're going to get into DME and bracing, you might want to actually have a separate verification form for DME that lists all of these questions, because DME is not going to be for every patient. So you may not want to clutter up your normal insurance verification form with these questions about DME. Just pull out a completely separate form and go through those questions one by one. And make sure when you are talking to the person on the other end of the line that you get their name, you record the time and day of that call. Ask if the call has been recorded and notate that on the verification of benefits, and then get a reference number for the call, because if they give you an incorrect verification, then with that data, we could possibly appeal that for you. Or if you're doing your own billing, then you could appeal that based on an incorrect verification. But you have to get some very, very specific data in order to be able to do that. So be very, very particular and very, very detailed about your verification of benefits. So the question, I get also a lot is, how do I know what diagnosis supports medical necessity for the bracing that I'm going to order? And what you'll find is that most products labeling will give you indications of what the brace is typically prescribed for. Now, some are more specific than others. You may have a certain type of knee brace that is very specific to post-surgical knee patients. Okay, it's a post-surgical knee brace. Okay, and so you would have to have some type of a diagnosis code, and you would also have to have an indication in the diagnosis that this was for a post-surgical rehab on that patient. Okay, the one that you see here, I just kind of looked up, and the package label said this functional knee brace is ideal for ACL, PCL, and MCL, LCL instabilities. So, looked up those types of codes, did some keyword searches in my ICD-10 code book, and I found that probably the most relevant diagnosis codes for this particular brace, for what the package label indicates this would be used for, would be a knee sprain or a knee instability. And so you'll notice that these knee sprain codes are very, very specific, and you would need to find the diagnosis code based on what knee this pertains to. Is it a right knee or a left knee? And also you would need to know if if you are using a knee sprain diagnosis, that you would need to determine what stage of care the patient is under. So if you're prescribing this knee brace for a patient who has had a knee strain and they're under active rehab right now, okay, or they are, this is for an acute injury that has just happened with a patient, then you're going to bill the S83.511A for an initial encounter. But if you are prescribing this during the healing or recovery phase of treatment, then you would bill the S83.511D code for a subsequent encounter. And again, if you have very particular questions about this, please feel free to contact me directly. I'll have my contact information throughout this presentation across the bottom of your screen, and then you'll have my contact information at the end of this presentation as well. So, another thing that it's important to do is work with a reputable bracing and DME supplier, because these are things that they can help you with as well, and they can guide you in the right direction for choosing the correct brace based on the diagnosis that you have for that patient. I'm going to strongly encourage you to use a reputable company. I mean, you can go online and you can find, XYZ bracing company that is based out of China or based overseas, or even based here in the United States, huge wholesalers that sell knee braces, and they may be a little bit less expensive by going that route, but they're not going to give you the support that you need to be able to correctly bill and establish medical necessity, and also help you with training on how to instruct your patients how to use these supplies correctly. And so you want a supplier who's going to give you all the support you need to successfully deliver, fit, and help you get paid for that bracing. Okay, so don't just look for the cheapest braces out there, because I'll just tell you, from my experience personally, years ago, my husband had a significant knee injury, and we probably spent ourselves literally hundreds and hundreds of dollars looking for, over-the-counter knee braces at CVS, or even ordering them wholesale from suppliers. And number one, half of the time they didn't work. The other half the time they broke because they were of such poor quality. You don't want to deal with that. When we finally went to a chiropractic office and had them order that supply and teach my husband how to use that supply, and we were able to bill our insurance, and our insurance paid for that supply, then we were able to help him on the road of recovery a lot faster. Just from my own personal testimony, I would say, don't be going out to these wholesale suppliers. Look for a reputable company. These suppliers you need to ask them, if you're talking to a supplier, do you give us the necessary documentation to help us establish medical necessity and to document medical necessity in our records? Do you give us guidance on what conditions this particular brace is indicated for? And will you be able to provide us with the training you need to properly fit the patient? Now, I've done some research for you, and one company that actually met all of these check boxes is a company called Azon Medical. Azon Medical is a wonderful organization. They check all of these boxes. And so this is a company that, I would feel very comfortable saying you need to check these folks out, because they are going to work with you, and they are going to help you find the correct product for the condition that you're treating your patient for. They're going to help you establish the medical necessity criteria, and they have the templates that you need for verifications of benefits and for letters of medical necessity that you need. And then they're going to help provide you with the training that you need to be able to fit these braces correctly on your patients. And so this is just a screenshot of the Azon Medical website. This takes it a little bit further down their homepage. You'll see that they give you all of these how-tos. They have blogs that will help you understand bracing a little bit better. And I've spoken with the folks there. Amanda Marrier is one of the co-owners of Azon Medical, and man, she's just amazing. And I will have all of their information for you here at the end of this presentation. And so, this is a great resource for you to use to obtain the bracing that you need. So, what are the steps that we need to take, to bill a DME supply to an insurance company? And so we're going to take you step by step through this now. The first thing that you need to do is evaluate your patient. And remember, the evaluation itself can be done through a telemedicine visit. Now, I'm not going to be getting into the telemedicine codes to use because we did this in our last two presentations. We got into the weeds with what codes can we use to do an evaluation of a patient for back pain or neck pain or knee pain, whatever the case might be. So for those of you who did not take those telemedicine visit webinars, I would advise you again, go back to the daily.amidoctors.com website and get to the archives and listen to those presentations on telemedicine. So you do the evaluation of the patient first. The next thing you do is qualify the patient. So do you think, based on the evaluation, that this patient might be a candidate for bracing? If the answer is yes, then verify coverage. So the next thing you do is make sure you do that very detailed verification of benefits, because you need to know if the patient is a candidate for bracing. If their insurance doesn't cover it, that doesn't mean you don't recommend it to the patient. Okay, so it's not like we're just billing DME only if they have insurance. If a patient needs bracing, you want to provide that bracing to the patient. The question is, does the patient have to pay for that bracing out of their pocket, or is this something that you could bill their insurance for? So verify coverage. The next step is complete the pre-auth if applicable. Now, one thing you'll find is that with a lot of bracing, if the value of the brace is over $1,000, many insurance companies will require you to do pre-auth. Now, not all of them, but many of them will. And so that's why it's going to be very important for you to understand whether pre-auth is going to be necessary based on the CPT or the HCPCS code that you are utilizing for that brace. Once you have completed the pre-auth, then you would order the supply and decide for yourself if you're going to deliver the brace personally to the patient or have the brace drop shipped to them. Once the patient has received the brace, it's very, very important, whether you deliver it to them or whether it's drop shipped, is to obtain a confirmation of delivery. Okay, you can't bill out the claim until you have received the confirmation of delivery. And once you've received that confirmation of delivery, and you place that confirmation of delivery in the patient record, then you have a complete record for that DME order, and you can then go ahead and bill out that DME. And then finally, schedule the fitting and the training to your patients. So schedule the patients for a fitting. And again, this piece of it can be done via telemedicine. Now, the actual claim for the brace itself is billed the same way, whether you are supplying it in the office or whether you are supplying it virtually to the patient. Basically, DME is used for home use. So one of the things that we find is a common error with DME is that you bill out the code, the HCPCS code, but you bill it out with the place of service as the office. And for most DME, what you're going to be doing is you're going to be billing out as the place of service for home. And the reason for that is because the supply is being used for home use. And so instead of place of service 11, you want to use place of service 12 when you're billing out that DME supply. But you don't have to bill the DME supply itself with a telemedicine code, okay? It's the evaluation and the fitting that is going to be the telemedicine service. The actual DME supply itself is billed as you usually would. And of course, again, if you need any help with billing or training on how to bill out a DME supply, please feel free to contact myself, and I'll be happy to set you up with a free consult on just some basic billing steps to successfully billing out that DME supply. My information is actually at the bottom of your screen right now. My phone number is 866-942-5655. You can reach us on our website, goldstarmedical.net, or you can email me as well, and I'll be happy to get back to you and help you with the billing out of these supplies. So the next thing I want to talk to you about is DME and Medicare. So most of the time, what we're dealing with in DME, because Medicare is very, very specific to you have to have a very particular type of DME licensure in order to bill out DME to Medicare. So really what we're looking at is, in everything we've talked about previous to this, we've been talking about billing out DME to your commercial payers. And it is literally, the majority of commercial payers are going to cover DME of some kind, especially if you are in an in-network provider. Now, you will find as an out-of-network provider, of course, in many cases, the DME deductibles are going to be higher, or the overall deductibles are going to be higher. And in some cases, out-of-network, they do not cover DME if you're an out-of-network provider. So you do need to specify both in and out-of-network benefits if you are out-of-network with that payer. But let's talk about Medicare for a minute. So I get a lot of misconception about DME and Medicare, and I hear chiropractic offices say, well, I can't bill DME because I'm a chiropractor. Or I get a lot of misnomer about it because they'll say, well, I know that if I bill, it's really costs a lot of money to get DME certification. And the first thing you need to understand about Medicare credentialing for DME is that there are two types of Medicare credentialing. You have what's called accredited and non-accredited. So accredited is where you actually set up yourself as a DME supplier, okay? The same way, you might have a DME supplier in your community with a storefront, and you can walk into that supplier and that supplier can bill out DME through your insurance and sell you DME retail as well. And that is called accredited. So typically, if you are a chiropractor and you do not have a medically integrated practice, then you would have to go through the accreditation process, okay? And as a chiropractor, under the accreditation process, without being medically integrated, you have issues of STARC violations, meaning the violation of self-referral. So if you're setting up a completely separate entity and you are a chiropractor and you're setting up a new organization as a chiropractor that is going to sell DME supplies, you're going to have to be very careful about using your own supply house to sell to your own patients. So it's not generally recommended that you do that. First of all, it costs a lot of money, $5,000 or more to go through the accreditation process. But for those of you who have medically integrated practices and you're going to sell DME only to your patients, this is where you would do non-accredited. And what you're doing is you are attesting that you're not going to be selling out DME supplies to the general public. you're only going to be using this for patient use. And to credential as a non-accredited organization, your group needs to be at least 5% MD owned. So MD owned by an MD or a DO. So if you're medically integrated and you have an MD or a DO that owns at least 5% of the medical corporation, you can go through non-accredited DME credentialing through Medicare. Okay. Now, under most cases, going through credentialing, whether you're going to decide to be accredited or non-accredited, it takes a long time. Medicare goes through very significant, there is an application fee to go through the non-accredited process is of about $600. To go through accreditation, it's going to cost $5,000 or more to utilize an accrediting organization to do all of the steps to get you accredited. It requires background checks. It may require bonding. It may require you to go through an on-site visit or a site visit through the accrediting organization. And so it could be very, very complicated, to say the least. However, COVID and the COVID crisis has created a small window of opportunity for providers to get DME accredited quickly. And this is called the 2019 novel coronavirus COVID-19 Medicare Provider Enrollment Relief. And this is taken directly from a CMS document in which it says CMS is exercising its 1135 waiver authority. Now, the 1135 waiver is the same waiver that is now allowing us to expand telemedicine to the extent that it's being expanded. Okay, so this 1135 waiver is also governing provider enrollment for Medicare, and it's there's two things I want to talk to you about. One is just general Medicare Part B enrollment for physicians and non-physician practitioners. So if you're listening to this and right now you don't have a Medicare number, this would be a way for you to very quickly obtain a number, a Medicare PTAN, in order for you to bill out Medicare, and you can actually do this in one day. All right. All of the Medicare payers out there in the United States, which are known as Medicare administrative contractors, have established toll-free hotlines to enroll and receive temporary Medicare billing privileges, same-day billing privileges. They are waiving the following screening requirements: the criminal background checks, site visits, and they're postponing all revalidation actions. So if you have received a notice of revalidation from Medicare, that has been postponed until the national emergency is lifted. Now, again, this is temporary, and once the national emergency is lifted, the document states that you will have 30 days to submit an actual application for enrollment. Okay, but literally all you have to do is call the telephone number for your MAC, give them some key pieces of information, and you would be able to supply Medicare services to your patients. Okay, now again, this might include home visits, and we're going to do a webinar somewhere a little bit down the road, maybe next week or the week after, on how to do home visits to your Medicare patients, which is going to be something that you can do if you have the Medicare billing privileges. So make sure you get the Medicare billing privileges to be able to offer home visits and telemedicine visits and things like that to your Medicare patients. But it also is including DME suppliers. And so CMS is exercising the waiver authority for all other providers and suppliers, including DME POS place of service. So what it is doing is, if you submit an application through Medicare online, and it is a clean web application, it will be processed within 7 business days. So what that means is that you could be offering bracing to your Medicare patients within 7 business days if you submit a clean web application. If you submit it on paper, in 14 business days. They will waive the application fee, so that $600 application fee is waived. Criminal background checks are waived and site visits are waived. And that's how they are going to be able to get these temporary billing privileges to you. And again, after the national emergency is lifted, you will want to submit you would want to go ahead. Then at that point, they'll have your application, but you'll have to undergo you'll have to send in the application fee within that 30 days and then submit to the criminal background check, the bonding, and the site visits. Okay. So if you want any information about this, okay, about getting the temporary billing privileges through Medicare, you can contact myself. My name is Lisa Majeski. Again, I am the owner and president of Gold Star Medical Business Services. Or if you already have a billing service that you work with, get with your billing service and have them help you get these temporary credentials so that you can deliver bracing to your patients. And the other things that we can help you with are verifying insurance coverage, helping you with your pre-authorizations. We can help you file claims and help you do denial management and appeals. These are all services that we provide as an outsourced medical billing company. Now, if you have a great billing team in place, and my philosophy on this is if it's not broke, don't fix it. You might not need us to do the billing for you, but maybe you need help with training. And if that's the case, we can provide you with some self-service options where we can give you the training you need in a lot more detail than I was able to provide in this short daily digest. But we want to be able to help train your office on how to take all of these steps to be able to deliver bracing effectively, ethically, and in a way that you're going to get paid and you're not going to find yourself losing money because you didn't do the correct steps to bill out the bracing. Azon Medical, their information is here. They are available to help you with the braces and the supplies themselves, the training and the support, provide you with some of the templates and the letters of medical necessity that you need. So we're here to help you. And we want you to feel free to call on us if you need these types of services. Okay. And I really want to thank you for your attendance today. So here are our contact numbers again. If you have questions, if you've been listening to this and you're thinking, man, I am just a chiropractic office and I'm not medically integrated. Maybe I can't do this bracing because of the accreditation process, and you want to look at becoming a medically integrated practice to where you can actually do durable medical equipment, then you would want to call AMI and see what that process is. How do I get medically integrated? If you need billing or credentialing help for these temporary billing privileges or virtual training for your staff during this time, please call on me. And if you have questions on DME and supplies, please call on Amanda at Azon Medical, and we would be happy to help you out. So I hope this presentation was informative and beneficial and helpful for you. It gives you another option of medical services that you can deliver to your patients during this very, very extraordinary time in our country and in history where we have patients who need us and we can't get to them. How frustrating is that? But there are options and there are solutions, and I do hope that you really seriously consider the options of durable medical equipment, supplies, and bracing for your patients. Thank you so much for your attendance today, and I hope to be talking to you again really soon. Good night and God bless.